I will show you how to place the Isocenter for a tangent breast plan. First, be in the right workspace, so I'm in external beam planning. And now let's go ahead and look at the CT slices for this patient. So you'll notice that there's several wires on the patient's skin surface. This wire here denotes the medial border of the breast tissue, and this wire over here denotes the lateral borders of the breast tissue. And this was palpated by the radiation oncologist in the CT scan. And we go ahead to the most superior slice of the breast tissue. And you'll see that we have a large wire placed along the patient's skin surface. And this once again denotes the superior border of the breast tissue, defined by the radiation oncologist. And on this slice, we created a contour called borders. And borders encompasses the whole CT slice, but defines the most superior slice of the breast tissue. You can see that here in the coronal view as well. So let's go back down through the scan, and you'll see a few other wires on the skin surface. This wire here denotes the scar or the incision site, and this will help place our Isocenter for the electron breast boost, which I'll show you in another video. And then we've also wired the patient's nipple, and this will be an anatomical landmark to set up our electron boost. And I'll once again show you that in another video. So here's the medial and lateral wires still, and we're approaching the most inferior slice. It's right here. So once again, we can see a large wire denoting the inferior border of the breast tissue, and then we place the border contour on the whole CT scan. So we have two contours for the border, and that's the superior and inferior. And if I select on borders here, and then right mouse, I can select the option Move Viewing Planes to Structure. And this will move the viewing planes to the center of these two border contours. So now you can see that our crosshairs are in the middle of the superior and inferior slice. And I'm just going to toggle slices here to make sure I'm right in the middle of a slice. So we're at the Z position of 21.35. And now I'm going to turn on a contour called rectangle. And this rectangle contour is drawn from the medial to lateral aspect of the breast tissue. I'm going to go ahead and move the crosshairs to the center of this contour. So right mouse once again on rectangle, move viewing plane to structure, and this moves the crosshairs to the center of the rectangle. So now I'm in the middle of the medial and lateral wires. And now I'm going to place my Isocenter at this point. So I'm going to go to Insert, New Marker, and I'm going to go ahead and type in the X, Y, and Z position of where the crosshairs are. So my X is 6.77, and my Y is negative 1.87, and my Z position is 21.35. So this does not need to be changed. So say OK. And you can see that Eclipse dropped a marker right in the middle of the rectangle. I will then rename this marker by right mousing on the marker, going to Properties, and I will call it Isocenter. And this completes how to place an Isocenter for a tangent breast patient. And as you can see, we have placed the Isocenter in the middle of the superior and inferior extent of the breast tissue, and also in between the medial and lateral extent of the breast tissue.